So next up is Mehdi Saeidi, and he will tell us about breaking the wall of knee replacements.
From your very first steps, wobbling, to this day, you've been using the largest joint in your body all of the time, the knee joint. Here you see a knee joint in flexion and extension. There is a thin layer of articular cartilage between the femur and tibia which plays a crucial role in a smooth movement of your knee joint. For some reason, this layer starts to degenerate and makes the life painful for 1 in 8 of us. It is called knee osteoarthritis. Unfortunately, there is no known cure for this disease, and apart from options which only manage the symptoms, the gold standard treatment is total knee replacement. Knee replacement is the best available option for later stage knee osteoarthritis, but even when you notice it at an earlier stage, there is not much you can do, and sooner than you would imagine, you will need a joint replacement. Apart from complications after surgery, knee replacement creates a huge financial burden on the health system. In Australia alone, $1.2 billion is spent on knee replacement every year. Our solution is a novel implant for the earliest stages of knee osteoarthritis. This implant attaches to the medial side of the knee joint and removes the excessive load through the knee in order to slow the progression of cartilage degeneration and repair cartilage. After a series of computer simulations and modeling, here is an experiment on a human knee joint. These pressure film sensors were inserted between the femur and tibia on the medial side with and without using the implant. The lighter color for the experiment with implant shows that part of the knee load is transferred through the implant instead of the knee. This load reduction means that osteoarthritis will slow down and cartilage will repair when the implant is used. To fix the implant to the bone, a lattice structure at the back of the implant and a uniquely designed porous screw with bone ingrowth capability have been considered. To predict and optimize the bone remodeling around the implant, I'm using an advanced technique based on bone cell interaction. Ladies and gentlemen, this is a patented implant, and my hope is that by using it, your need for a knee replacement will be postponed for many years. Thank you all so much.
Mehdi, your questions right in the middle, please.
Thank you for that. This is still an invasive procedure and we're still potentially going to have post-surgical complications. When we compare it to a knee replacement, how is it better?
The fact is, knee replacement is considered as a very invasive surgery. However, there is minimally invasive option for knee replacement. This one is definitely categorized under minimally invasive surgeries because we do not affect the natural anatomy. We do not cut the surface of the femur. We do not change the tissues. And we have your knee, and we just attach this implant next to your knee. So this is minimally invasive, and from my point of view, based on the experience that we have had, it's by far less invasive than knee replacement.
Question up there, please. Well, we start there and then over.
Thank you. Do these the implants that you've designed, do they have to be individually designed, or is it one size fits all? And secondly, what's the sort of recovery time for one of these implants compared to a conventional knee replacement?
One of the great advantages of this implant is it's patient specific. So we do the MRI of your knee, we import it to the CAD software, we design, we modify it based on the CAD file of your knee joint, We export it and produce it by additive manufacturing. So this is absolutely for yourself, for your knee. It's patient-specific. Your second question was, sorry, what was the first again?
The recovery time.
Okay. Recovery time for knee replacement is 3 to 6 months, and it's a very heavy rehabilitation process. For this one, as I said, we do not affect the natural anatomy. We do not change anything. That we just need to have a very comprehensive rehabilitation. It's minimally invasive, and we just think that we have a very short period of time to just be adjusted, and we can discharge the patient very soon.
Final question there in the back.
How common is it for people to present early on in their degeneration so you can come in and actually prevent the injury from occurring?
The fact is, it's very common, but because knee replacement is recommended for patients after age of 65, you can't just do anything. So it starts from age of 45. For athletes, for professional athletes, it starts at sooner. For example, in this country, we have rugby, and they definitely suffer from this disease earlier. So it's very common, but the fact is they don't do anything. They should take medications and other treatments until reach to the age of 65, because the average longevity of the implant for the knee replacement is 15 years, and after that they should do another invasive surgery again to do the revision. So it's extremely common. Thank you.
Thank you. And let's thank Mehdi again.
Thank you so much.